Welcome back. In this video, we will talk about the symptoms that any patient feels 6 hours before a stroke occurs. What should you do if you experience these symptoms before becoming a paraplegic patient? The brain has a large network of blood vessels. Through it, blood reaches the brain. It takes oxygen and glucose from the blood, which is the brain's food. This makes the brain control the body and do its job perfectly. A clot occurs when a specific part of an artery that feeds a specific area in the brain begins to shrink. Later, fatty lumps or some clotted blood come in and close this place in the artery. The blood gradually decreases until its passage is finally stopped. In this case, the part of the brain that feeds from this artery is affected. This lasts 4 to 6 hours. During this period, you will experience 5 symptoms. 1. Numbness in the middle of the face along with numbness of the hand and leg. Numbness occurs in the right part of the body or in the left part. 2. Raise your hands up. The hand that suffers from numbness will fall down immediately. This indicates that there is no control from the brain to the arm. This is not caused by cartilage because it occurs without pain in the arm. 3. The eye in the area of numbness will not be able to close it properly, in addition to blurred vision. This is accompanied by a crooked mouth when you smile. 4. Headache. Either in whole or in part. 5. Lack of concentration. You will find the affected person having difficulty speaking and unable to concentrate. All 5 symptoms indicate that a stroke is going to happen soon. The best solution is to take the patient who has these symptoms to the hospital immediately. Doctors will examine these symptoms and give the patient medication to dissolve the clot and enable blood to pass through the closed artery and access to the part of the brain that feeds from this artery. The sooner you take treatment, the lower the risk of damage to your body. Damage that is limited to mid-body weakness will be easy to treat through physical therapy. While you will need a longer period of physical therapy if you are late in taking the treatment, or after removing the clot site by a surgeon. There is another type of stroke that is more serious and causes fainting in the patient, where bleeding occurs in an artery because the artery wall is very thin and weak. With high blood pressure, blood bursts out of the artery and clots in the brain. In this case, doctors will give the patient drugs to stop bleeding and other drugs to remove blood from the brain and surgical intervention. The patient will suffer from severe difficulty in the movement of the arms and fingers and a longer period of physical therapy from the first case. We'll talk soon about how to protect yourself from stroke and what are the foods and healthy practices to prevent it. We welcome all new subscribers to the channel.
Thank you for watching. Subscribe to like channel to receive all new news.